Well, welcome everybody. Welcome to the session about behavioral health employment opportunities. So what you're here for to get your degree and go out in the world and hopefully find that great job that you're looking for. I am here to present three people that are going to talk with you today. First is Brian Ferrans, has an undergraduate degree in sociology, criminal justice from Colorado State University, and a Master's of Science degree in Criminal Justice Healthcare from Colorado State University Global. He has spent the past 12 years working on improving our systems of care for individuals with mental health and substance use disorders across our local behavioral health, criminal justice, and fire EMS systems. Brian works for SummitStone Health Partners, a local community mental health center. Currently, he serves as the Deputy Executive Director of the new 64-bed acute care facility built by Larimer County and funded by a 2018 sales tax initiative. He has previously served as Poudre Fire Authority's Community Risk Reduction and Outreach Manager and the Health District of Northern Colorado, Northern Larimer County, Community Impact Team Director. During the pandemic, Brian helped to develop and run the COVID-19 isolation quarantine site for people experiencing homelessness in Larimer County as part of the Health District's COVID-19 response. He currently serves as a member on the Larimer County Behavioral Health Policy Advisory Council and as a board member of Outreach Fort Collins. Brian has served in the Colorado Army National Guard. He lives in Fort Collins and his wife and 3 young children. Priscilla Gardea. Priscilla is a talent acquisition specialist and recruiter with SummitStone Health Partners. She has a BA in English from Adams State University and an MS in education from Colorado State University. Priscilla has done access and equity work in education for almost 20 years at such organizations such as Educational Talent Search, Upward Bound, and Colorado Educational Services and Development Association, in addition to having worked at her 2 alumna mater. I'm sorry, I'm having difficulty right now. Alma maters, I can really say that. Shannon Hughes, Dr. Shannon Hughes is an associate professor at the School of Social Work at Colorado State University. She teaches, consults, and conducts research on how we use drugs and medicines in our society today. She is a community organizer and leader in articulating and shifting paradigms around our relationships with self and medicines and drugs. Dr. Hughes is also actively involved in supporting peer support movements in her state, with a particular interest in the development of peer respite and psychosocial alternatives to hospitalization for persons experiencing acute distress or extreme states. She's a founding member of the NOAC Society 501c3, a Colorado-based nonprofit providing community education and organization around psychedelics and drug policy reform. In her private practice, Dr. Hughes blends spirituality with life coaching and psycho-spiritual integration of psychedelic experiences. Welcome. There we go. So let me get your slides going here, if that's what you guys have slides?
Yeah.
There we go.
Perfect. Thank you. Welcome everybody. My name is Brian Ferrans. I work for SummitStone Health Partners, and we're all excited to be here and talk with you all about some local career opportunities. So I'm going to share a little bit about SummitStone Health Partners and the work that we do, and then also share about a really exciting project that is happening here in Larimer County with behavioral health services. So let's see. Okay, so SummitStone is Larimer County's community mental health center. So we provide a ton of services across the community, mostly for lower income Medicaid eligible individuals. So just to talk through some of our services to give you an idea of kind of the work that we do across the community. So we have a 16-bed substance use disorder residential treatment program called Gardea House. That is over in Fort Collins, over by Poudre Valley Hospital. That opened up early in 2021, right during the pandemic, which had its challenges, but it's a great program. It's a circle program, one of 3 in Colorado, so it's serving individuals with co-occurring disorders. And then we also have a 10-bed crisis stabilization unit, also over there on Riverside. And that is a 24/7 facility. We have a behavioral health urgent care that can, a walk-in urgent care there that's open till midnight. Our mobile crisis response team responds out of that facility. And then we have started in the last like 18 months, really doing some rapid access medication assisted treatment services. So individuals can walk in, they can meet with a prescriber and start getting on some MAT services for the substance disorder. And then our community mental health center, I mean, we have a ton of outpatient locations spread out across Larimer County. We work with almost every population. So we've got youth and adolescent, family, adults, veterans, people experiencing homelessness. So we've got, I think, 10 outpatient locations. We have a bunch of community-based programs where we embed our staff with different community partners. We've got a lot of forensic and criminal justice type programming. We've got staff in the jail, staff in our community corrections programs, the wellness courts, things like that. So we do offer a variety of behavioral health services and support services. So that's really exciting. So this is just a little bit of our philosophy of care, and specifically around kind of our, I mean, it's SummitStone, but also our acute care services, which I'm going to talk about here in a few. But really, we want to create as much of a no wrong door process and access as possible. So we want to be able to give the community ready access to services. And so I'll talk more about what that's going to look like at the new acute care facility, but we want people to be able to just walk in and have a safe, compassionate, empathetic place for them to receive care in that moment. And so you can see some of our other philosophy of care points. So to talk about this really exciting project that's been happening in Larimer County for a while now. So a little background. So in 2018, Larimer County passed a sales tax initiative. It was a 0.25 cents on $100 sales tax initiative to put funding towards behavioral health services in the community. And doing so, they prioritized funding sort of these three different areas. So funding for this impact fund grant program, and Jessica, she oversees that grant funding program. They put out a ton of dollars into the community for local nonprofits and other community partnerships, and invested those dollars every year. So this was a 20-year sales tax initiative, and that is really unique. So I mean, to live and work in a community where the community and the residents sort of said, we believe in providing behavioral health services. We are committed so much to this that we're going to put our tax dollars towards this. That is a unique initiative. The other part of the funding was to prioritize this acute care facility that I'm going to talk about here in the next few slides, but really a no wrong door crisis facility that has walk-in accessibility. So to pay for the construction of that and to help fund some of the operations of that facility. And then this third category is this future bridge fund initiative, which I think the county is still kind of ironing out what that's going to look like, but really to provide some, stopgap funding and help fill gaps in care that we know, financial, transportation, other support services that maybe aren't traditionally funded through health insurance or other areas. So those are the kind of three areas that the funding covers. But I'm going to talk the next few slides specifically about number 2 in the acute care facility that's under construction right now. So this is the acute care facility at the Longview campus. Like I said, the county passed this initiative. So the county is constructing this facility. It is out on the southwest part of Fort Collins, right in between Fort Collins and Loveland Taft and Trilby Road. And it is, yeah, I think 65% complete at this point. So we are hoping to have it finished mid-September. And then the county has contracted with SummitStone Health Partners to provide the behavioral health services in this facility. So this facility is a 64-bed acute care facility. And if you ever get the chance to drive out there, I know that as it gets closer to completion, there will be community tours and things like that, but it is quite impressive to get out there and see kind of the size and scope of this thing. And it's going to add a ton of access to acute behavioral health services in our community. So so we tried to design the services. The county really had in mind of as much of like one-stop sort of shopping services for the community, knowing that it can be difficult to get access to care quickly. And so in partnership with SummitStone, we've really tried to build as many levels of care into one facility as possible so that we don't have to shuttle people back and forth around to different programs in the community, and try and do as much in-house as we can. So you can see we're going to offer multiple levels of care. So we will have that 24/7 walk-in behavioral health urgent care, as well as a bridge clinic. So that urgent care is meant anybody in a self-defined crisis, a loved one, a friend can walk in and get assessed for care and get started with care right then. As well as a 23-hour observation unit. And really what that looks like is we'll have these recliners that we can sort of put folks in up to 23 hours. Maybe they don't need to be admitted into a longer inpatient stay on one of our units, but they just need some stabilization. Maybe they need some medications to get stabilized, some discharge planning, and we can sort of observe them and care for them in that unit. We'll also have withdrawal management, or formerly known as detox beds. So we've moved away from the language of detox because this is mental health and substance disorders are medical diseases, and so we have shifted our language to match sort of the medical model of this care. So we'll have withdrawal management beds. We will have crisis stabilization, which we already have at our Riverside. We have 10 beds, but we will increase our bed capacity at this facility for crisis stabilization. And then eventually we'll have substance use disorder residential treatment. So the Gardea house location that I mentioned that SummitStone operates, we are going to have those same level of care beds, additional ones at the acute care facility on the Longview campus. We will be able to do medical clearance, medication management, again, medication assisted treatment through that walk-in urgent care. We'll have an on-site pharmacy, on-site lab. So, I mean, when you think about comprehensive services, we're really trying to build as much as we can into this one facility. One, so that we can properly divert folks from our emergency departments and jails. We don't want that to be the first place of care for individuals with behavioral health disorders. And that was really a large intent of this sales tax initiative in this facility being passed, is the community doesn't want that either. We want folks getting access to behavioral health care when they need it and with the professionals that are trained to provide that care. So this is just a quick layout of what the facility is going to look like. So you can see that it is 2 stories on this side, but right here is kind of the main entrance. And again, this facility has been designed by the county. I mean, it is a beautiful building. It's been designed with the intent to offer compassionate, safe, a warm, welcoming environment. And then we have our urgent care that will operate here. We've got our withdrawal management unit, crisis unit. These will be additional crisis beds. And then this second floor unit, we will not open right away. But eventually that's slated to be those additional residential substance use disorder beds. So yeah, in pharmacy and lab. So again, really trying to build out kind of a mini hospital model of care. So it is impressive and beautiful, and it's out there on 40 acres of county land that the county intends to build out as a wellness campus at some point. So what does that mean for you all? We are hoping to open doors to patients by the end of this year, so early December. And what that means for me is that we are trying to hire all of these disciplines to staff this facility. And we need your help to do that. So this facility is going to be one of the most comprehensive behavioral health facilities in Colorado. It is really unique for us to offer that many different levels of care and be licensed in that many different ways under one roof. So it really is an innovative design. And as you can see, we need folks of all types of disciplines. So we do behavioral health care, we do medical care. So we need clinicians, licensed, unlicensed. We need peers, we need care coordinators, we need physicians, psychiatrists, and we need a lot of them, as you can see, to open those doors. And so we're investing in a lot of cool programs and recruitment initiatives. So we've got clinical internship programs that we're offering stipends for students, and that's been going really well for the last 2 years. We've gotten, I think we have 12 right now, and 10 of them are staying with us and transitioning into positions at SummitStone. We've started some new apprenticeship programs, and then we're working on building this as a center of excellence. So we really want this to be a teaching facility. So we want internships, externships, work studies, eventually, hopefully some medical residency programs. I mean, we really want this to be the place where you come and learn about behavioral health care and how to do that. So yeah, so you can, we've got a lot of positions posted now, and we will continue to keep posting positions as we work towards starting those services in December. And you can find those at our careers page. And then I know Priscilla is going to talk more about what that career path looks like at SummitStone. So I'll pass it to Shannon, and then we'll do questions at the end.
The owl is off, so I'm gonna see if I can get that going.
I'm gonna put a timer on so I be quick and make sure Priscilla has time and we have questions.
Sorry,
No,
that was my.
I was planning on doing that anyway. So I'm going to talk a little bit about the sort of more non-traditional alternative pathways. And unlike Longview, where we're like, we've got 100 positions we're hiring for, these are less carved paths that are not like, here's where you get your job. And that's just sort of how it is in the more non-traditional and alternatives world. So, you know, we carve these paths as we go. And I'm going to talk just a moment about two main things that I've been involved in. So one is psychedelic assisted therapy, and the other is the peer support world, which is a huge movement nationally and has been for a long time. And so I'm going to start quickly. Oh, and this is, I'm with the School of Social Work, and then I have other places you can find me also. And so is anybody, how familiar are folks with this, what's happening in with psychedelic assisted therapies? Are people have heard of it? Some people, okay, most people, if you're watching me online, most people are going like this. So yeah, so here's just a couple of examples. MDMA and psilocybin both were designated as breakthrough therapies for PTSD, for depression, respectively. And so it's a really different way of how we're using psychoactive substances in healing. And that's been my area of work for a long time. It's like, how are we using psychoactive drugs in the mental health system, right? And how are we using drugs like in our society? And what's our relationship to different drugs and the socio-political economy around how we're using drugs? And so this is a really interesting sort of reemergence of substances that have been demonized and prohibited and criminalized, kind of coming back and actually being designated breakthrough therapies. And so just real quick, I'm not going to go into like the model, what it looks like, what a psychedelic therapy session looks like. I would love to do that another time, but just not today. But I did want to just note that sort of the pipeline of what is coming down the road in psychedelic assisted therapies. So we have folks already using ketamine off-label and therapy for depression, anxiety, lots of different things. But I think what people are really waiting for is MDMA for PTSD. Trials for FDA approval are completed, and so the FDA is reviewing all the data, and we expect this year or next year that MDMA might be available for PTSD. But then also it's being used for eating disorders, relationship issues, end-of-life anxiety, other indications. Psilocybin mushrooms are a little further along, further behind. And the FDA approval process is going to be a few more years before they're available by prescription through like that kind of mode, the same track that MDMA is going for depression and end-of-life anxiety and distress. And of course, we had Prop 122 in Colorado pass, so we'll see over the next year how that shapes up and how psilocybin might be sort of integrated into more traditional healthcare settings. There's a lot of work, especially like CU Anschutz in the palliative care departments, doing a lot of work on figuring out how are we going to be able to integrate and operate under like a Prop 122 regulated healing access model using psilocybin for palliative care. And then you have some other things, ibogaine for addictions and opioid withdrawal, ayahuasca for depression. So there's other things that are like even earlier in clinical studies, but are gaining a lot of interest. And ibogaine, and these are also, ibogaine and ayahuasca are also decriminalized under Prop 122. So sorry, things are really wonky in my slides there. But basically, so as far as like how do you get into this emerging field, it's kind of like a hurry up and wait. There's no like carved pathways right now. But if you're looking to do MDMA assisted therapy, when that's available next year, you will have to complete the MAPS, which is the organization taking MDMA through the clinical trial process. You'd have to be certified through their training program. Once psilocybin is available, it's Compass who's holding the patent on that form of therapy. You'll have to be trained by them. Prop 122 to operate in Colorado. We'll know probably by the end of this year what training and certification will look like to work with psilocybin in different capacities. And so there's just like kind of different pathways into depending on which area you want to work in. I can say a lot more about that if you want to talk later or another time. And then there's like certainly programs that are doing training and certification, but for what? It's so unclear because it's like, there's not like, here, I'm an MDMA therapist now. It's like, okay, how do you get prepared and set up to go into this more non-traditional route, even while those pathways aren't completely clear right now because we're still waiting on laws to change and FDA approval and all of these things to happen. But there are some training programs. I'm with Elemental. We do some trainings and things, workshops and things. Okay. That was a real quick and dirty. That was I hope hopefully useful. It's just like very brief umbrella overview. And so the other sort of non-traditional alternative world is this peer support world. And peers are when we say peers, we mean people who have lived experience with any of these things. And by peer support, it's just a way of relating in relationships. It's different from sort of the clinical, the clinician-patient relationship. This is like we're on equal ground. There's mutuality in the relationship. We're learning and growing together based off of our shared lived experience. And let's see here. And it's really about building community. So this kind of pathway is like, okay, so we have these facilities and we have systems and we have these traditional systems. And also, how do we create pockets of like communities where people can support each other, and there's like non-clinical alternatives that people can plug into and find healing in communities. So this is just one of the, Yard Collective is one of the organizations in Landmark County. I'm a part of that organization also that is really building out a lot of peer support and doing a lot of peer support education and training and peer support certification. And so one of the things that Your Collective does is lead these alternatives to suicide peer support groups. We have several of them running in the community. These are like drop-in style groups, but the idea is that, there's no, in the peer-to-peer relationship where you're like using the wisdom of your lived experience to connect with other people, there's no assessment, we're not diagnosing, we're not reporting, there's no coercion, we don't do any of that, and that's in these spaces. This is really a space where, like, yes, if you're having suicidal thoughts or if you have in the past, you can show up and be met with curiosity and with human connection and really try to explore the pain and like what's going on. And there is no like reporting that there's no, no one's going to call the police on you. No one's going to take you to the hospital, which some people can find pretty traumatic, actually. Okay, and so here's just like a list of things going on with Yarrow Collective. Please just visit the website. I won't go through this in the interest of time, but yarrowcollective.org, you can find the full calendar of like weekly groups and all kinds of things that you could like drop into or refer people to. But just in the peer support world in general, there's lots of ways. I think it's going to be a really, really growing area. And even if we get this question a lot of like, who doesn't have lived experience? Like, even if you're a clinician or a therapist or whoever, it's not like you like are immune from having suffered from crippling depression or something. And so there's a lot of this, there's also a lot of interest in like, okay, we get a lot of questions from people who have lived experience on like, do I want to exist in the peer support world? Is that sort of my pathway into this work? Or do I want to exist in the clinical world and like get the degrees? And that's kind of a different identity or different hat that you're wearing if you do have that sort of like dual identity. So that's an interesting conversation to have, and I won't go into right now, but there is this pathway. It's not paid as well, the peer world, but it's a really beautiful pathway into the work. And it's more community, it's, definitely community-based, but it also opens up other ways of understanding your experience outside of a medicalized worldview. And so for some people that can be quite empowering to tell a different story about their experience. And then there's, peer recovery coaching in the substance use world, peer respite alternatives and like the crisis response world. So there's like peer pathways and all kinds of sort of the range of services that you would find in behavioral health. And then beautiful Yarrow Collective is starting to do some beautiful like rites of passage work with young people and, rooting back into like ancestral wisdom and like lineage work. And so there's some really beautiful things happening in that world. And if you would like, you are invited to attend I'm right at 10 minutes. We have a webinar coming up. It's free on the 31st if you're interested. This is peer respite, which is an alternative to hospitalization for folks in crisis. And we're trying to like envision what peer-run, non-clinical, community-based peer respites could look like in Lambert County. And we've got a bunch of people joining us who are part of peer respites around the country that we really admire. So it'll be a fun conversation. Please sign up at Yarrow Collective if you're interested. And that is it for me. I'm going to hand it. Thank you very much.
All right. I didn't have to get the hook or anything.
I know. I was like, we can do it.
Sure thing. So good afternoon now. My name is Priscilla Gardea. My pronouns are she, her, and hers. And I serve as one of the recruiters at SummitStone Health Partners. And so you got to hear about the great opportunities that we have at SummitStone and which way we are moving, the direction of Longview. It's really, really exciting. And some other areas. So this growth in the law that we just passed. I mean, lots of opportunities. And so as soon to be recent graduates, I know no one has ever asked you, what are you going to do after graduation, right? No one said that so far. But it's my job to help you figure out what that bridge looks like between now as you're finishing your schooling and education, whatever field you are, and what one of these or any other opportunity looks like. So that is what I get to do, is I get to help amazing people who want to give care and help others in roles to do that kind of work. So I get to do this all day, every day. So I'm pretty excited about that. So we did mention a little bit of the benefits. I think Shannon, you mentioned, oh, this is the position that pays X amount. Well, yes, pay is going to be important. We live in a capitalistic society where you need to pay your bills and cell phones aren't free and all of those things. And what other factors other than money are going to be important when you're going to be making a decision on where you want to start your career. So I put together some things to consider. The first is location. Where do you want to be? Are you tied to a geographic location? Are you interested in going to a space? I mean, now is a great time when you have this new chapter that you're about to embark on. So what are some of the places that you see yourself? And spoiler, there's a shortage of behavioral health clinicians across the United States. So if you want to go be a therapist in Hawaii, I bet you there's going to be a job there waiting for you. If you want to go to Alaska, Maine, Florida, but you know what? Colorado's pretty great too. So I hope that you'll consider staying. Think about what the culture looks like. And this is a hard gauge depending on the questions you might ask in an interview. I mean, you can see our website, beautiful pictures, we say all the right things. Talk to recruiters, talk to hiring leaders, talk to other staff members, and talk about what the culture, what is a work-life balance going to be like? How does the leadership live out the values of our organization? So think about the culture of a place. What are the values that you have and the values of an organization, and how do they align? So some people may be more values driven than others. I find myself being one of those people. I have a strong value in equity work and social justice work, and that's one of the values of SummitStone. So I really, really got pulled into this organization because of that. And so if you are interested in learning about systems of oppression, if you are interested in thinking about, okay, well, here's how our organization works with folks outside of different privileged identities. How can we do that? I think it's important to recognize that not all organizations are going to be able to do that. You all are probably aware about some of the laws going into place that actually prevent DEI work in a lot of states. So a lot of states, a lot of caregivers across healthcare and a lot of industries are no longer going to be able to practice, for example, gender affirming care, which is one of the things that we do at SummitStone and other organizations here locally can do. So look at some of the values of organizations when you're inquiring about whether or not you could see yourself working for them. And then total compensation. So yes, we know about what is my paycheck going to be, but compensation, the way we consider it, is a whole package. So what does that look like? And this is the interactive part. So tell me you value me without telling me you value me. What are some things that as a new soon-to-be employee, you're going to say, yes, this shows that I am valued. No wrong answers, and I promise I won't put the box after. Yeah.
Flexible work schedules.
Flexible work schedules. Talk to me about flexible work schedules. Yep.
Persons who later morning or afternoons versus flexibility.
That's huge, and not everyone can have that. So ask about that. Yep. What's another way to feel valued? Paid leave time. Yes. PTO, please. Extended leave bank for emergencies that happen. Yes. That's going to be part of the conversation. What else? Benefits. Yep. That's something that I remember when I graduated. I was like, oh yeah, I can think about this. And it turns out that not all companies pay for their employee benefits. Some people have to pay for them themselves. So ours, thankfully, is fully covered for our employees. But if you have dependents, for example, that's a cost to pay for their coverage. So benefits is a big factor as well. There's a couple of others. I snuck them in there. You want me to tell you? You ready? Okay. I see it. You're like thinking and thinking. Okay. So yeah, we talked about benefits. Medical, vision, dental. And this can look a lot of different ways. So I learned, so I had never worked at a place, but we cover the first $1,500 of an employee's deductible every year. And these are free. And other places like, let's just say medical will be included, but then you have to pay for each of these. So look at the benefits package. When you get your offer letter, you're going to get the benefits package and really look through it and see, okay, well, they're going to pay me this much, but then I have to pay this much for insurance. And if you don't have insurance in another way, then that may be something that you consider. What does the PTO look like? And is it rolled in with sick leave? Is sick leave separate from that? So how much time am I going to get to go on my trip with my friend? Because I hope that you still stay in touch with these friends who moved to Hawaii to be social workers over there, and then you can go visit them, but you need time off to do that. What is the potential for bonuses? Yes, it is not just corporate America that gets these bonuses. So I'll give you an example. At SummitStone, we have a program called Summit Reach, where you have a productivity rating for the week. So let's just say in one given week, we expect you to have 50% of your time to work with clients. And anything over that is bonus potential. So you can earn anywhere from $2,000 to $23,000 on top of your annual salary every year. In addition to bonuses for like work productivity, we also have sign-on bonuses. Again, that shortage is really benefiting you all. Graduating during a time, I graduated in the recession, so very different time. But we have sign-on bonuses for, we call them hard to fill positions. Any master's level clinician role is going to be eligible for a $10,000 lump sum bonus, which is taxable. So ask those questions as well. RNs, if you have any friends in the nursing field, these industries that are really looking for people, you can get these bonuses. Ask about retirement. This is the #1 thing I wish I could go back and tell young baby Priscilla when she was graduating, like, put money in your retirement now. I know you hear it a million times. This is a 1,000,001. Start saving. And employers sometimes can contribute to some of those savings. We match up to 4%. And so if whatever you contribute up to 4% will give you an additional on top of that. And different companies do it different ways. Sometimes they offer different terms or in terms of retirement funds. So look at those details when you get your offers. Sometimes you can get a program differential. And so if you work in the jail for our jail-based positions, that's an additional pay. So you get a percentage on top of your hourly rate. If you work overnights, you get an additional, I think it's like $3.60 on top of your hourly rate for that. If you work in crisis, you get an additional 20% of your pay on top of that. And so lots of different ways to kind of, yes, here's your base salary, but here's some ways to kind of pad it a little bit. If you speak Spanish, you get an additional 5%. So what are some of the languages? What are some of those skills that you have that can help boost up your potential earning? We also offer moving reimbursements. And so if you have friends from out of state that have wanted to come to Colorado, we reimburse up to $5,000. So if you really want to go to Nebraska or wherever else you want to go out of state, ask them if they offer moving cost reimbursement, or sometimes they give stipends for moving, because again, we are looking for very qualified people. Educational reimbursement. So if you don't have a licensure, we will help you cover those costs. A lot of companies will do that. And so ask about how we cover the certification costs, licensure fees. Do we provide supervision hours? So definitely ask about those. And loan forgiveness. Nonprofits working in one of these industries should make you eligible for loan forgiveness if you did take out loans as a student. And that's a good way to get some of that money cut off. And then areas for growth. So if you really are interested in working with folks who are experiencing homelessness, or if you really want to work and learn more about EMDR, or if you want to focus on an area, what are areas that you can grow? What are the opportunities for advancement? Okay, I'm starting out as a clinician. How do I become a team lead? How do I become a supervisor? What are those steps that I need? And they can help lay out that clear path for you. Questions on this? Okay. Next steps. Do not be this baby. I've done this, especially in the snow. So don't miss any of the steps. Yes, you can talk with recruiters and you get hired, and what next? So there's a whole process I just want you all to be aware of, including a background check, reference check, which also maybe includes social media, not with us, but some organizations do that. So clean up your social media, get a professional email if you don't have one already, but some steps to get these things taken care of. You'll have to go through credentialing. And so you'll have to make sure that your degree is accredited and confirmed, and a couple of those steps there. Register through license. I always recommend for people to preemptively register with DORA just to start that process, because it really does help in the hiring process. And then eventually working towards your licensure. So those are the pieces that I want you to be aware of as you're thinking about jumping into this field. The last thing I'll say that if you really do want to stay in Colorado, which like I said, I hope you do, some things to be aware of. In Colorado, it is a legal requirement for jobs that are posted to have a salary range. So it should always have what they expect the pay to be. And the way the law is written, it's really intended to help people. Like if I was applying for a job, but it's a bunch of good old boys and they're going to start me at the low end, then the law is intended to have it so that I don't have to negotiate for pay. So we have a formula that we use for determining a salary range that's based on years of experience. And so really the intention is to always make sure that people get the wage that they deserve based on years of experience. And so ideally, people shouldn't have to negotiate. And quite frankly, it happens all the time. So it never hurts to ask. We are never going to rescind an offer just because you ask for more money or you ask for any kind of negotiation on the things we're talking about. So really, I want you all to feel advocated for and empowered in making this decision, because you all are going to be the treasures that we're all going to be fighting for in the next couple of weeks all over the United States. And so I'm really thankful that you all get to go into this industry and that we get to be here to help you figure out what the next steps look like. So that is all of the information that I have. And I think at this point, we're going to open it up to questions.
Just curious, I'm going to be starting my master's this fall, but I'm going to be doing my bachelor's this summer. Do you hire people with that?
We do. They are, so there's level 1, level 2, level 3 clinicians. Level 1 is a bachelor's level. Level 2 is a master's level, and level 3 is licensed. And so you can come in as a bachelor's level. And a lot of times those, like we have our mobile crisis folks, crisis specifically, they hire a lot of bachelor's level 1 positions, or case managers or bachelor's level. So yes, at all levels, we hire folks that are out of high school as peer specialists. So you mentioned the peer role, we hire those. And I think there was another session that talked about kind of ways to be in the industry without specifically being direct facing. And so if you wanted to do something like that. So yeah, bachelor's level, come on over. Yeah. I know it was a lot of good information and you're like digesting it. Okay.
As far as like looking for employment, where would a student start as far as not just with SummitStone, but with behavioral health in general?
So I find that a lot of organizations in behavioral health are using big platforms like Indeed, LinkedIn, ZipRecruiter. ZipRecruiter is not my favorite. I probably use Indeed the most. But I would, if you find something that you like on one of those larger websites, go to that company's direct website, because that's going to be the most direct and updated information, because oftentimes they're really not updated very often, and it can be a little bit tricky. Each company should have people like me, and so become our best friend, and then we can have these conversations. So definitely don't feel like you have to go through this stuff alone. Yes, you totally can. I can give you my business card, and I will leave a little stack of business cards here too. For those of you that are thinking about questions and you're like, I'm an internal processor, and you can ask me your question afterwards as well. So yes, I'd be glad to take a look at that.
Or is it like both ends, like direct or like?
I would say both and, yeah. Depends on what you want to do. And because things are always growing. I mean, we have positions that, for example, with Longview that we haven't even posted yet, that we don't have job descriptions for. And so it's a really exciting field. And I mean, the stuff that you're talking about, Shannon, like, hurry up and wait, right?
Yeah.
Yeah. But it's an exciting time. I really think you all are at a huge advantage. And it just makes me so glad that you all picked industries that serve others and make the world a better place. So really make sure that you all are taken care of as well. Is it fair to say that we will stick around for questions? But otherwise, I really appreciate your time today.
Thank you.